In this episode of the Ben Shapiro Sunday Special, Dr. Drew Pinsky, a board-certified internist and addiction medicine specialist, shares his insights on the current state of the American medical establishment, particularly in light of recent crises such as the COVID-19 pandemic and the opioid epidemic. With over 35 years of experience in medicine and media, Dr. Pinsky's perspective sheds light on the complexities and challenges facing healthcare professionals today. Dr. Pinsky begins by discussing a startling statistic. Approximately 70% of physicians are now employees rather than independent practitioners. This shift has created a culture of fear within the medical community, where doctors are hesitant to voice their opinions or challenge hospital administrators for fear of losing their jobs. During the COVID-19 pandemic, this fear was exacerbated, leading to a situation where hospital protocols dictated how doctors treated patients, often prioritizing administrative directives over medical judgment. Dr. Pinsky expresses his astonishment at the extent to which physicians felt compelled to remain silent, even when they disagreed with the treatment protocols being enforced. As the conversation progresses, Dr. Pinsky highlights the broader implications of this fear-driven environment. He notes that trust in the American medical establishment has deteriorated significantly, paralleling the decline in trust in other institutions such as government and media. This erosion of trust is particularly concerning given the critical role that trust plays in effective healthcare delivery. When patients lose faith in their doctors and the healthcare system, it undermines the very foundation of medical practice. Dr. Pinsky shares his personal experiences with censorship in the media, particularly during his time at CNN and HLN. He recounts how his attempts to discuss the health implications of political candidates were met with resistance, ultimately leading to his exclusion from the networks. This experience underscores the challenges faced by medical professionals who seek to engage in open dialogue about health issues, particularly when those discussions intersect with politics. Dr. Pinsky emphasizes the importance of free speech in medicine, arguing that open discourse is essential for the advancement of medical knowledge and practice. The discussion then shifts to the opioid crisis, which Dr. Pinsky describes as a significant misadventure in American medicine. He traces the origins of the crisis back to the late 19th century, when physicians were the primary distributors of opioids. The subsequent backlash led to a phobia around prescribing these medications, which was later reversed in the 1970s as pain management became a priority. However, this shift resulted in overprescription and a new wave of addiction. Dr. Pinsky laments the lack of accountability for those who contributed to the crisis, noting that the medical community must learn from these mistakes to avoid repeating them in the future. Dr. Pinsky's insights on the COVID-19 pandemic are particularly poignant. He expresses frustration with the way the pandemic was managed, highlighting the lack of transparency and the rapid dissemination of misinformation. He points out that the medical community was often forced to operate under guidelines that were not based on solid evidence, leading to confusion and mistrust among patients. The pandemic revealed the fragility of the healthcare system and the need for a more robust and transparent approach to public health. The conversation also touches on the topic of vaccines, particularly the mRNA vaccines developed for COVID-19. Dr. Pinsky acknowledges the initial enthusiasm surrounding the vaccines, but expresses concern about the lack of long-term data and the potential risks associated with their use. He emphasizes the importance of informed consent and the need for patients to have access to comprehensive information about the benefits and risks of vaccination. Dr. Pinsky cautions against the blanket vilification of all vaccines, noting that while some vaccines have proven to be effective, the approach to COVID-19 vaccination raised significant ethical questions. Throughout the discussion, Dr. Pinsky underscores the importance of community and trust in healthcare. He argues that the breakdown of traditional community structures, including churches and local organizations, has contributed to the current crisis in mental health and addiction. He emphasizes that healthcare providers must work to rebuild these connections and foster a sense of community among patients. By doing so, they can create an environment where individuals feel supported and empowered to seek help. As the episode concludes, Dr. Pinsky expresses hope for the future of American medicine. He calls for a return to the core principles of medical practice, emphasizing the need for physicians to prioritize patient care above all else. He advocates for a more patient-centered approach that empowers individuals to take control of their health and well-being.